Call to order.
Yep, second.
All right. This meeting is being recorded. So if anyone is recording, they need to notify it at this time. All right. So move to open the meeting.
Second.
All right. So passes. Move to accept the minutes from both June 25th and
There you are.
Awesome. How you doing?
Good.
Awesome. And May 28th.
Second.
All right. We're just accepting the meeting minutes. So passes. Roll call.
Ellis Taylor.
Tomas Riley.
Greenbacher. All right. And we're just going to move to public comment. So open the meeting for public comment.
Second.
Public comment.
Would you like to go first or second? I am happy to go. I'll go.
Hi. Thanks for recognizing.
Come up here.
Yeah.
Everybody.
Whoa.
I am here tonight to sort of beg the mercy of the Board of Health or ask you to think about something, okay? So I think, well, some of you probably know, I'm a retired nurse. So health is something that is definitely a focus of mine. And now I'm the mayor. And that's a different position to be in. And it's come to my attention that that the permanent revocations of tobacco licenses are permanent and have effects on the downtown. Okay. So I wanted to ask you, so I'm just going to talk for a little bit. I'm not going to mention any particular places, but I said, this comes before you all the time. I know that this is something that every month you will have something with tobacco violations and you deal with them and you have rules that have been put in order. And I know that we made more stringent rules here, and that's a good thing. I don't want anybody to smoke. It's a terrible thing. And it's a habit that you get addicted to and people can't change. And that's an awful thing. But the permanent revocation is problematic. We have empty storefronts downtown. We have Rite Aid that's leaving as we speak, and I'm charged with trying to run a city. And when that's just having a very negative effect on the downtown. And I think when two of you were both here in your very first meeting, which was a tough one. And I don't know how you would do this, but I'm asking for either reconsideration or looking at the actual regulations. I know I've just been reading the paper, and I think in Heath or Charlemont, there was somebody that was in trouble 3 times, and a large fine and requiring the checking with, like Sandries does with inserting something, is something that might work better than a permanent revocations. People are losing livelihoods, and that's a concern of mine. And it's a different concern than you have. And I'm asking it's not easy to be a mayor. It's not easy for you to be Board of Health members. And I wanted you to know where I come from with all that. Megan, I'm sorry, I'm having my back to you. Because I'm talking with people here, but you're out there. And I think I have to keep everything going. And everybody should obey the law. And it sounds like this is a problem in every municipality. But a permanent revocation is having a big effect here. And perhaps I'll ask the mercy of the court that you would maybe on a different agenda bring that up, or I don't know what else to say. I just wanted to, I don't know exactly where my role is here, but I know that it's the overall picture of the city that I'm charged with. And when I see something that's having a big effect in one spot, I have to say something. And I feel a little uncomfortable doing that, but that's okay. It's kind of always the overall good that I go to. And I think that perhaps there's a different way to do that. Well, I'm gonna back off and listen to what you have to say, but, if any, you have more questions for me later, or you want to talk about it, it's fine. That's all I'm gonna say for right now. Okay, thank you for your service. I'm gonna sit here and watch.
Thank you for your time.
Hi, gentlemen.
Hi, hello.
Good. I drove in from Uxbridge because I'm house sitting and I really wanted to be here tonight for a few minutes. I have been following the Board of Health long before all of you were involved, and sometimes I haven't been able to be there, and we've had great success with pulling people in and dealing with some health sanitation code violations over at the Weldon over the years. Megan was there back then also. So I also am thinking of the greater good, and I watched what was happening. I actually clipped the thing about the Cold River package store up in Charlemont. And it was the same situation where it's, I think pretty much, you have to go that way for the whitewater rafting and you're heading, and then there's activities in Berkshire East and so forth. So they had the same thing. They had a violation, young people receiving tobacco that shouldn't have. They were found, the fine was 5,000. Somebody in that, according to that article in the Recorder, asked if they could pay a little less. They said, no, that's set by the state. But they were also, had to be suspended, had to take all the tobacco property out. But they are also told they could give a device. And that way you cannot sell a packet of tobacco without this particular device. I saw the same situation that I was following at the Green Mark convenience store here recently. And, and he was a wonderful man who was talking about that should never have happened. He wished it hadn't. Other people were working. He wasn't on the premises. And so you hear these different scenarios. And again, he also was offered by this group, are you willing to pay for this thing? And once you get your tobacco props back, you cannot have a sale. And that way you're not shut down. You're not losing your license permanently. It's my understanding it just blocks everything. I just watched somebody buy some tobacco and they scanned the license. I was coming back up forth on Route 2. I also watched where Isaac Mass was involved in, how safe is the food that's served there in the Greenfield Cinema. And it became like, well, what about the ice machine? And maybe he'll take out the nacho thing rather than, and then training people on the Heimlich maneuver or having some kind of a, what happens if people choke? And like the mayor said, after years of teaching, I was a CNA, so I know quite a bit about hospice and healthcare and did it both on the premise and also in people's individual homes. So, and Isaac, I believe, might have done a little compromising. I don't think he had to take out his nacho machine, but he was talking about people burning their mouth if he personally has to nuke something to make it hot. So I just thought it was like a good to have an inspection, good to have a give and take about what the regulations say. And we are struggling to stop being a blighted downtown area. And so I just look at like, okay, we lost Taco Bell and we lost KFC, and that was pretty gross. When Megan would remember what was going on with that, everything from the bathroom to the oil to sticking to the floor. And then the management would say, that's the night shift. And then the night people would say, well, that's the morning shifts, so after a while, the doors are shut. And I'm all for not getting sick when we go out and we eat in public. And I know that you do inspect regularly and you need to follow up. And I think you should. And I'm pretty sure you're allowed to just follow up, show up. You don't have to call and say, okay, I'm coming over, because then all of a sudden everybody scrubs, cleans, and it looks beachy, right? they do that in institutions, and I know about that too. I guess my last thing I'll say, because I'm probably over the 2 minutes, is that I'm going to check out the website for the Board of Health, and I'm going to see if the state sanitation codes are somewhere there or linked to them. And also the regulations for tobacco should be readily available for Joe Schmo. I don't smoke, thank God, I never did, but just as an educational thing, as an awareness thing. And I was on one board once where we had an innumerate number of people giving feedback to the State Board of Health to change the code regulations. They weren't monitoring shelters. There was nothing about porta potties, unsanitate, like they realized that they really need to revamp it and make it much more inclusive of keeping people safe. So I really appreciate your time. That's just pretty much all I wanted to say today. And you can go out. I know I missed Megan's report last time, so I'll listen to what Megan has to say as well.
To that point, we actually were looking at starting a Facebook page and having a little more readable resources set up. So we're going to work on that with our new media person for the town. So hopefully we'll have more stuff like that out. We do send a copy of our tobacco regulations when we do send out our renewals too.
So I'm sure they're very aware. I don't think they're allowed to just play.
But I think it's a good idea just because this is an issue
Mhm.
and the regulations and our fines, suspensions, and even revocations are state-based, not,
Right.
not
It doesn't, it's
city-based.
not, you're not the bad guys.
Right.
You have to follow what
Right.
you're being told, right?
And in fact, there have been a couple times where, state tobacco, the tobacco board was saying like, hey, you may want to think about giving a stricter, penalty. But we've always stuck, since we've been here working together as this board, we've stuck with, we cannot go less strict than the state. So our hands are a little bit tied in these situations where, if the state mandates that we fine, that we suspend, that we revoke, that's what we have to do. We have I see Mayor shaking her head. We don't have the power to, we can, and again, let me know if this is wrong, but we have the power to give out more strict fines, punishments, but we don't have the power to give less strict punishments and fines,
There's a
suspensions.
certain floor that we.
Right.
So that's true. There are some caveats in some ordinances that are personally Greenfield kind of added.
Yeah.
So we can always look at those. I can always go through those with you at some point,
Right.
and just show you what we specifically added as Greenfield. But yeah,
And
the majority of things are state.
I will say during last month's discussion with that particular business and that particular individual,
Thank you.
I think it was something that was very much for me, speaking as an individual, was definitely something I definitely thought about a lot, was person's livelihood and their business. And I do think we kind of included that in the conversation a lot. And that's why I did want to kind of make it, a little bit idiot proof in the sense that you can't sell this unless they're scanning their ID card. So,
Right.
If it was up to me, I would hope that every business would do that, you know what I mean? Because
And it may be worth us thinking about asking the businesses to do that earlier in the process, so that, because if we don't have a third or fourth offense, then we never have to even worry about revocation or long-term suspension. And our job is to keep our community safe. But we also, we had a speaker come in and talk with us. We also our job is not to punish people. Our job is actually to try to get people to adhere to
Education.
the laws of right. And so, if we do not have to impose anything, we don't want to take those things away. But again, as far as I understand, we don't have that much leeway in the minimum penalties.
Yeah, we can certainly look, I can go over the regulations with us at a meeting, if you guys want to set it on the agenda.
Yeah,
We can certainly go over what specific to Greenfield and what's state and what you could possibly change if you wanted to, or if you didn't want to. You can certainly make amendments and things like that. You can certainly make a regulation that says every shop in Greenfield has to have one of those scanners if you want to. there's certainly ways we can look at that to try to, kind of cut that from happening out of the
Right.
equation. So we can certainly look at that in the future if you'd like to.
Like, I would definitely say
I
like.
think it would be good anyways, just so you guys have a better
Yeah,
handle.
like I don't feel my role here is to be blindly punitive, like, you know, what I mean?
No, no, no.
And like certainly like it was definitely within my consideration, but that's the only case I've dealt with because I'm so new to the board.
Right.
But I was certainly very cognizant that, like, you know, this is this gentleman's livelihood and I don't want to take that away from him. you know?
Right, and I think the mayor's comment is, we have empty storefronts and
For sure.
tobaccos make up a big portion of a lot of the corner store sales, and so. And we want them to be selling to adults and not to children. And, we don't want another generation hooked on tobacco. And if we can make sure that we support them in their legal sales of tobacco, awesome.
Yeah, I
I
mean,
think it's important to recognize that 98% or so of the tobacco stores are following the rules.
Right.
We just have a couple that continuously break the rules. And a lot of the complaints that we're getting are from other tobacco retailers saying this person's selling flavored products, so they're going there. One of the problems that we're having, that I have just recently found out about, is that even the scanners don't always work because the owners will scan their own IDs or, anybody else's ID, and it'll go through the register. So people that are not following the rules continuously are probably, it's not going to be a foolproof, making people have these scanners, if they don't follow the rules to begin with, probably aren't going to do anything. And that also means if it goes through the cash register, and, I just got a call recently about somebody who was selling tobacco products without a license. So they're not using these products anyway. They're not using this. They don't need a scanner, wouldn't help them,
Right.
So I think it's really important. And, Dr. Greenbacker, I think you came to one of the Massachusetts Health Board meetings with us, and they talk about the tobacco regulations and how the Board of Health is supposed to be separate from other entities because we're supposed to just concentrate on the health of the population. So unfortunately, that's not the role of the Board of Health is to think about the other things. I know they're important. I'm not downplaying that at all. It's really sucks to see empty storefronts, but I think we really need to concentrate on the health. And like the vaping population in children at schools is outrageous and it's out of control. I mean, Ellis, he works at a school, I'm sure you see it. It's just not okay. If it were me, I'd much rather see an empty storefront and higher taxes than see a 12-year-old out vaping. And Mayor, I am apologizing now because I'm sure you're probably really mad at me for saying this.
That's not my way.
But as a public health nurse, this problem is out of control. And if people are going to continuously break the rules, there's got to be a line. And I don't know. I'm at a loss for words.
I think point well taken, right? Our job is to keep the community safe. And like things like the card scanner, not foolproof. At the same time, everything the things that we can do to encourage, people abiding by the law, I think it's worth taking. And if we can prevent people from selling to minors, then I think it's worth doing those things. And it won't be foolproof. And most likely, if they're still selling to minors, they'll likely be found out and address it.
I don't think you're gonna find anything foolproof. There's
No,
always,
nothing, yeah.
there's always gonna be a
Yeah.
workaround. But I
You're
think
very
that-
determined, nothing, yeah.
But it's, it's something, it's another added layer of protection. But yeah, we can certainly talk about that. And again, since you weren't the board that passed the tobacco regulations, I mean, it's worth going through them anyways closely with you guys. Because again, you weren't the ones that wrote them or passed them. So it's better to get a better understanding of them anyways.
Yeah, so
Especially since it keeps coming up.
I can
Yeah.
email out I'll email you out this form, and it's highlighted in yellow where the board has a say. It's highlighted in green where you have no say.
Okay,
So there's
perfect.
only a couple lines like where it says for the suspensions, like you can choose, there's some that say like up to 30 days and you can say like shall give it for 7 days instead of 30 days, but you make that like permanent in your
Right.
record. So
Okay.
the last time we did the I think it was in June of 2024, we put it as shall for 30 days on like the third offense. But you could do shall for 7 days or shall for 10 days. You have to give a suspension, has to be at least 7 days, but you can choose from 7 to 30. But the Tobacco Coalition recommended that we do a shall with a specific number because otherwise there could be discrimination and things like that. Because one person could get a 7 day, 2 months later, somebody else could get a 10 day or, and that's why they wanted us to do it as a shall and then the specific days.
Which I think is a
Yeah.
good idea.
Yeah, that's a good document to send to Megan, because it
Yeah,
does,
I
it
will
does
send that out tonight.
explain what's
Can you
ours.
can you send a copy to me as well?
Absolutely. Yes.
Ginny.Disorder, not the mayor, Alan. Okay,
Any dot. So yes.
thank you.
Thank you,
Yeah,
Megan.
that'd be helpful. Right.
All right, Megan, you want to go with your stuff?
Yeah. So I have some, well, bad news, but really great news. Tick-borne diseases are sky high right now. Our anaplasmosis cases are doubled from this time last year. But Robin Knipe, who works for our Valley Health Regional Collaborative, is an amazing nurse. She wrote a letter to Joe Comerford, who bumped it up to the DPH. We heard from the head veterinarian at Dr. Katie Brown. And she sent out a memo to all of the physicians' offices and providers around talking about the protocols, because we've been finding that some patients will go to their doctors with a known tick bite and they'll be like, oh, you don't have a rash, you don't need treatment, we don't need to do testing, and they go home and then 4 days later they're in the hospital. So we brought that to the attention of Joe Comerford and brought it up to the state level, and hopefully that's going to get addressed now. Robin also had this thing. We used to have a call that would be able to do like for Paxlovid. When somebody would have COVID, you call the Paxlovid line and get your medicine without having to go to a doctor's visit and things like that. So she's working with the state to see if that might be something that they might be able to do for tick bites. So that you could call up the line, get doses of doxycycline, and be done.
And this would be like,
So
this would be exposure, like.
yeah,
type stuff?
yeah, yeah. If you had a known tick
Post
bite,
exposure.
unsure of how long it had been on, if it's been, more than 36 hours.
So not for a positive test, but just for exposure.
No, just for
the
exposure.
200 of doxy, yeah.
Yeah. Positive tests, you go to your regular doctor
Yeah.
for the 10-day or 30-day, whatever
Right.
you're going to get. But yeah, so that is like absolutely amazing news. I'm like, this is public health at its best. Because we had a patient that didn't get treated, went to the ER, she went to her doctors, didn't get a test or anything, went to the ER, didn't get treatment, but got a test. I called several days later. This was like 4 days later when the lab finally came into my system, Maven. I called Bay State and talked to the infection control nurse. The patient still didn't know. Now we're like 3 weeks after the bite, and she was so sick. And I ended up calling the patient, which is not something that I'm supposed to need to do. It's supposed to be the providers that call, but the patient still hadn't heard and so I called and I was like, listen, you need to go and get treatment right away. You're positive. So then she called her PCP right away, who still didn't know that she was positive, and got on meds. But she was very sick at that point.
Yeah, I mean, I've seen 3 positives just so far this week, so.
Yeah, it's absolutely out of control. On another great note is we are giving away free bug spray at the health department. On the 4th of July, I went around with my wagon to the fireworks and handed out bug spray to everybody. Actually, I think you were there, right?
I was indeed.
But yeah, so you know, we're trying to prevent these things. Another, I know I'm gonna kind of jump around because I have like 3 things that I'm going to talk about, and so it might be in under a different section, but we got our first positive West Nile virus.
Okay.
It was actually in Leiden, but it was an 01301 zip code, so that's why we get notified.
Okay.
They trap mosquitoes, and anyone who's belongs to the mosquito Pioneer Valley Mosquito Control District, they trap mosquitoes to see which ones have triple E, West Nile virus, and we just got our first. There's many years where we don't get any at all. Last year we had one, and now we have one. So again, just spreading the word about bug spray. We put a Facebook post out through the city website.
Saw that.
Perfect. Good. So I'm glad people are seeing these things. Just because it's just dangerous. We also have mosquito dunks at the health department. We have a limited supply that people can throw in standing water. So if you have a bird bath, we want you to clean out your bird baths and things like that twice a day. I know that's excessive, but that's the only thing that's going to prevent the spread of mosquitoes. But if you choose not to do that, the mosquito dunks, you can throw a tab in, doesn't hurt the birds or anything like that. It just kills mosquito larvae, and not any of the other animals that would be enjoying the water. So we have those at the health department too. And lint rollers to get off the ticks. That's something that we're like really pushing. Sarah's been doing a lot of TikToks, Leverett and Shutesbury, and we're just spreading the word. Let's see what else. That we do have one COVID cluster with 17 in a care facility. It's not anything that I'm very worried about at the.
Oh, yes. Froze.
Still there, Megan? You froze a
time
little.
because we've had, hundreds at care facilities. So 17, it's a.
I have to check your connection, Megan.
We work with the state for emergency preparedness. So when we held up the vaccine,
Megan, back up like
Yeah, you froze a little bit.
30 seconds.
Yeah, so last thing we had heard that there was a cluster of 17 in a care home, and then you cut it.
oh, sorry. I'm not really worried about that one because we've seen much higher numbers and they're following all of the precautions. The next thing is I am the representative for MAP.
Can you hear us still?
It's Mohawk Area Public
okay.
Health Coalition, and that's
To see it.
One call with these remote meetings and.
Just going off video usually corrects it.
Right.
Still there, Megan? Can you hear me?
Looks like
She's,
You're muted.
yeah.
okay. Sorry. I don't know where I left off, but Mohawk Area Public Health Coalition. I need, if you still want me to be the representative, we meet, well, it's supposed to be once a month, but I'm on the steering committee, so I meet like once a week, for a couple hours. But if you want me to be the representative still, then I need you to take a vote and say that I can be the representative for this coming year.
I'll do that now.
If you don't want me to be the representative, then one of you gets to do it.
So,
You want to vote on that now, Megan?
all right.
Yeah, sure.
Okay.
I'll make a motion for you to continue to be on the board.
Seconded.
All right, let's vote. Vote passes unanimous.
Mike, you
stay
could have
here
always
now.
raised your hand to join too.
I have enough committees.
Then I have, so for other nursing type business, I sent you guys the body work, regulations that I'm drafting up. You might, they're long. So one of the issues that kind of all of the country is having right now is that their human trafficking is a thing. So massage therapists, they're vetted, they go through query checks, things like that. They have to go through the licensing commission, but there's other places that are body works practitioners. So it could be Reiki and things like that, but they don't need to do any of those things. They could just open up a shop. They could be a registered sex offender. There's no regulation. So I went through and looked at some of the other cities and towns. I looked at Sudbury, Plymouth, and Wareham or Weymouth, one of the two, and just kind of drafted up some plans that you guys could look at. They're in the very beginning stages, but they looked good to me after my like fourth read through of them. So just think about it. It's nothing that we have to do now. You know, we can think about it. We would have to have a public hearing. That has to be posted 21 days in advance. We'll let anybody, like we'll post it in the newspaper so that anybody who is a body works practitioner could come and talk about, you know, how it might affect them and, you know, what concerns they might have and things like that with the regulations. But, you know, this is before anything gets passed or anything like that. Just in the beginning. So open cases, I did go into JC's Market. One of my inspectors went in for a food inspection and found some illegally flavored products and blunt wraps, which are banned in Greenfield. Well, the flavored are all over the state, the blunt wraps specifically for Greenfield. So there was supposed to be I didn't realize I was calling Meredith from the Tobacco Coalition. It turns out there should have been a $1,000 fine, but I only gave them a $300 fine because I thought it was a local regulation, but it wasn't. So because I had already written it up and it was totally my mistake, I said, okay, well, we'll just keep it at this, but you know, just make sure you pay it. It's going to be considered your first offense. It's been 7 days and they didn't appeal it to the board. So that is going to be considered their first offense on a tobacco violation. Although when I did go in there, Samir Khan was working in there. Samir Khan is supposed to be the new owner of Green Mart. And when I asked him who owns the store, he said he didn't know, but later when I did some records searching, I found out that it was his brother who owned it. So I think we really need to like button down on our application process for next year to find out everything's got to match. I'm going to come up with some draft regulations. I'll send them to you. Just saying that this is what we need on the permit, and like the alcohol permit needs to match the Department of Revenue, that needs to match the LLC, that needs to match the owner. The owner will have to come in person to do the application. We just really have to tighten this up because it's a big issue. And yeah, I think that might be all. I can talk one of the things I have on Mike's list, but I can just tell you that the VHRC half-time position and the Greenfield full-time inspection positions are now posted online, and we will be starting the interviews as soon as we get applicants.
We do have one
Sorry,
applicant
I
for
tried to
the,
talk fast.
we do have one applicant for the VHRC part-time that I think we'll be interviewing next week. So hopefully we get some more. Fortunately, it came for the part-time and not the full-time. But we also saw that Amherst posted a full-time at like twice the salary of ours. It's just kind of bad timing. Yeah, it's bad timing, and they're also in that area, so that's just kind of bad timing. But we'll see. Hopefully, more people look at it and we can get that out there. All right, so you all set, Megan?
I think so. I think that's all I have on my list.
Okay, I'll just go into mine real quick. I had a couple condemnations since the last time we met. I got a call from the police over one of the weekends for a residence at 12 Miles Street. It was apartment 22. They were concerned about the conditions of the property. I ended up going over there. The place was extremely filthy. Just built into the floors, walls, ceiling, trash everywhere, mattress completely soiled. Apparently the person was getting some service from ServiceNet. I'm not quite sure why no one ever went in the apartment, but apparently they were saying that they met with this person, but never really, they don't go in the residences really. I was made aware from the manager of the building because he was tracking feces around into the hallways. And that's kind of where they started investigating. So I did go there. They had brought him to the hospital. I made the hospital aware that he couldn't return to the place, so they kept him there for as long as they can. I believe they sent him into a program for a little bit, but he is returning to the apartment. I am due to do a reinspection there, hopefully next week at some point. I'm waiting for the person from ServiceNet, his caseworker, to call me back. So I can go back in, make sure everything's cleaned appropriately, new mattress, everything works in the apartment. I did warn them too, though, that I would want them to keep a better eye on it because I feel that if they want him to go back in there, then they need to be more responsible about how he's living in there. So hopefully they'll keep a better eye on it. So I do have that coming up, hopefully for reinspection for that. My next incident that came up was 231 Conway Street. I was also made aware by the police that had gone over there for some complaints of trash and noise and possibly people squatting in the apartment. So we went over there. I went over with the building inspector and the fire inspector and the sheriff's office and Greenfield PD. We made contact with the owner there. We made entrance into the house. The house was kind of in disarray, some cleanliness issues. The biggest issue was they had the electric and the heat sources were turned off. Electric meter was turned off by Eversource. The heat was, they had taken the meter completely out of the building. So they had no gas heat. So those are both condemnable offenses. So I made them aware that they would have to leave the residence within 24 hours because of those issues. Two of the people responded that they would leave. They had ended up leaving the next day. The main person that I was talking to when I went there, he was ultimately arrested for felony animal cruelty, for issues that they had with animals that were in the house previously. And animals, again, when we were there and being the animal inspector, we had a dog in a crate with no food, no water. So we made that decision that he should probably go for that. So they took him away for that. I ended up meeting with the landlord later when I went to go post my condemnation on the apartment. He did state that he would work on cleaning the outside and get a dumpster and start doing the apartment. He did say that he was going to change the locks, keep the people out. I did condemn it, so they couldn't return anyways. So hopefully those people won't be going back and he will be actively trying to clean the property. I will keep up on him because he did say he was going to get a dumpster. I haven't seen anything come out yet. So I am going to push him next week to see what his plans are. I'm trying to get back out there and get it cleaned up. Because there is a substantial pile of trash and there's a couple other apartments there. I also have an older lady in the back who was having some hot water issues. He told me he was going to take care of those. I did check. She did not respond back to me yet, but I will check in again with her to make sure that those issues are taken care of in a timely manner. But I will be keeping an eye on those two properties to make sure that they don't fall back into disarray. After that, so I did meet with the Cannabis Control Commission and people from the FERCog about the social consumption regulations that it will be coming out. I did get a draft copy of the regulations that I will send to you guys. They're pretty extensive. But the biggest part that came out of that is that there will be caveats in the regulations that we can make our own kind of decisions on as a town and the Board of Health. So as far as the social consumption altogether, if they didn't want to have social consumption, I believe that still needs to go to like a citywide vote as they did with, if you wanted dispensaries in your town or if you wanted, legal cannabis, they did a townwide vote when it first came out. I believe that's going to be the same issue with the social consumption. Then on top of it, there'll be little caveats as if we kind of went round and round as the Cannabis Control Commission will have jurisdiction over the actual social consumption site itself and where the marijuana is sold from. But we kind of got into a back and forth about, are we going to allow it to be sold in kind of buildings where you can have children or at events where you can have younger people? Because again, we kind of got into the whole point where yes, they'll be, they'll have jurisdiction over the site, but what can happen outside of the site that kind of falls into our jurisdiction? And what do we want to do to try to make it less available to anybody that's not supposed to have it? So there will be little parts in the law where we can make changes on a town site on, do we want this part of it? Do we want to strengthen another part of it? So when we go through the regulation, we can look at certain things like that will kind of fall to our town to decide on. So we can certainly look at that. The other things I had, I'm gonna say right now, the only other things I have right now is that I am covering a couple of the towns in the grant. So we are covering Shutesbury, Leverett, Sunderland. I've been covering their septic. We might be picking up some of Deerfield now. Their inspector is going to be out for a little bit of time. So I offered to help with some of their septic stuff too. So I will be going out to those different towns doing septic work with them too. Other than that,
Greenfield's totally caught up, right?
yes, Greenfield's actually doing good. Now we're trying to catch up the other towns in our grant, which is good though, because we're helping them and they're very appreciative of it. So we're getting our inspector, Corey, for the VHRC grant, has been going out there and getting some of their food places up to snuff. Some of them needed some help, so they're getting there, but we're getting them online. And then they are very happy that with the septic work, I've made myself available to them. So they've been happy that they're getting things done, and homeowners have been pretty happy with that too. So that's been good. The other thing, like I said, we were working on the Facebook page and some of the media stuff to try to get that out there. Yeah, our food stuff in town has been pretty steady. Yeah, we haven't had any major complaints, minor complaints of trash and stuff at McDonald's, but it's mostly on Saturdays when they're slammed from people going back and forth on trips to Vermont and everything else. I'm guessing they're short staffed. We have talked to them a number of times already. They did have some mechanical issues with their walk-in too, where it wasn't really holding temp. We did see that a maintenance person was there yesterday up on the roof, hopefully fixing that. So they've been proactive on fixing the things that we've had issues with them. Other than that, we haven't had any other issues with any other food service establishments for lately. I have had some housing complaints that are coming and going. Luckily, I haven't had a lot lately, just some of these drastic ones where they reach those points where I have to go in. Other than that, I haven't had a lot of really bad ones that have come up. And yeah, I think that's it right now. Great. Been a little slow because people are on vacations mostly. So middle of the summer slows down a little bit, beginning and the end, start picking up a little more. But yeah, right now I think that's been pretty good. But I will get I'll get you those draft regs on the cannabis regulations. We can start looking at that. Once you guys think you've read them enough and have enough questions, we'll put it on an agenda for a future meeting and we can talk about that. And like Megan said too, we can do the same thing with the body work. We'll go back and forth on that. We can do edits and whatever you want, and then we can do the hearing, get that out there, and then we can really doctor it into what we want for that.
In the cannabis regulations, is it obvious where we have leeway?
It will be, and some places will be a little more obscure. But I can certainly reach out to the cannabis control and get as many answers as we can from them. They've been very helpful. I know they've been looking at me a lot too, because we've had issues at the fairgrounds and we've had a lot going on. So the Cannabis Control Commissioner actually said he was familiar with us from all the stuff we had, and then in some of the things they were thinking about how to proceed based on, how things we had to deal with over here. So I did reach out to him because we did have, it was called the Flower Expo. We did have one event at the fairgrounds that was just distributors of cannabis that were already licensed by the Cannabis Control Commission. And they had a whole event up there where they actually brought cannabis, but it was all locked up in certain containers and boxes and shown in certain ways. And they did a beautiful job, and we had no issues up there during that event. So I did point the Cannabis Control Commission to trying to talk to them, the people that put on that event, because we thought that was a very good event, and that might be, kind of like a plan for social consumption at a bigger event like the fairgrounds or something, to hold something like that. But again, I think the biggest concern a lot with the FERCog and us was how available it will be to children and other people at those events. Should we make them just 21 plus events? Should social consumption sites just be 21 like a bar, or should it be more like a restaurant where you can have the bar and 21 over area, but still have areas where children could be? So I think those are the things that we'll have to kind of dig into on what we really think Greenfield would really want and what would work for us. So yeah.
Different type of fireworks issues up with that?
I did have a meeting with some of the homeowners around the fairground fireworks. They did express concerns. Sure they would love to talk at some point during public comment, and I welcome them to come if they watch this meeting, if they want to talk about it in public comment. They had concerns, I believe, the fairgrounds is a touchy subject for fireworks because it is kind of in that neighborhood. I know in the health issues in general, I know, it kind of goes to then the town fireworks, kind of in a neighborhood too, but more up on a cliff a little further away. I think their concerns, which I didn't really think of one point was, the fireworks at the fairgrounds, they're closer to the neighborhoods. Falling debris, some of the chemicals that fall from exploding fireworks. And one thing I didn't even think about is some of their gardens. They brought up that some of their gardens could be contaminated with falling ash and falling chemicals into their plants and food source. So that was something new that I wasn't really even thinking of myself that they brought up. So there are certain aspects on why I can see that they don't like them in that area. So we can certainly discuss that at some point if you want. I'm sure they.
And how many firework events are there typically?
There is only one. So there is only one event, which is at the fairgrounds. They allow fireworks.
Yeah, what, there's New Year's and then there's 4th of July.
So they just do 4th of July.
We have one, like 4th of July.
4th of July at the fairgrounds, and then they do a 4th of July at Poetry Tower.
Yeah.
Yeah, so the one at Poetry Tower is put on by the town. I did go to that event earlier before everybody else showed up because I was doing the food stuff. I believe that one went off fine. I didn't have any issues with vendors. That was fine. And Megan handed out her bug spray, so that was good and people were happy. So there's ours and then there's theirs. Now, I think there's always something you can look at too. Would you want to say those are the only two we want to allow? I mean, that's certainly something you could say that we don't want to allow anymore. Or, you can always go that maybe the fairgrounds isn't the best place for them. I think it's, you can look into it. It's something we can discuss at some point. Like I said, I did talk to them at length about their issues, but I welcome them to come and discuss them with you as well. Because they do have a lot of science and knowledge behind it, showing fireworks are hazardous. And what kind of brought it up to me afterwards is the couple accidents with fireworks around the country. After I met with them, that kind of didn't put a great shine on fireworks either, buildings blowing up, people dying. So there are other hazards to fireworks, as we know. So I think there's always a way to look at it, and we can certainly entertain looking at that a little more, maybe seeing if that is an acceptable place to have them or not. Yeah, so I think that's it. All I had.
Yeah, I think that might be all. One really great thing that maybe I should, since we always talk about bad things, I want to say one more good thing is that for our food, our food inspector noticed that a lot of the plans, like vomiting and diarrhea plans and things like that, were only in English. So we reached out to UMass, and with grant funds, we were able to get them translated into languages that people were requesting, like Chinese and Mandarin. There was 3 languages that we got them translated in, and that was really well received. So I think there's some really great things happening that weren't happening before. So I'm super excited about the way things are going now.
Yeah, and our intern Bella from MHOA, she's actually gone out on her own inspections. So she's gotten some of the places that we haven't been able to get into. Some of the different CSO homes and things like that. She's been able to go out to and get in there. So that's been good. So she's been getting some good training and some on-site work doing that. And then, and then hopefully I'll be posting for that part-time admin assistant too. I think it just had to go through the admin union for the town to accept into their union. And then I believe once they give the okay, I can post that out. So we'll get that out there too.
Well, what's happening with, who's working on the Facebook?
So we just in the beginning stages. So we asked can we do it? Because before they kind of had it, but I think it was kind of run by every different department and not really cohesive. So they kind of stopped that, which is probably best. So now it's going to be, I think we're going to work with the communication director, the new one.
Very cool.
To make more of like a cohesive Facebook for that department.
And can we have it linked to an Instagram feed?
Yeah, we're thinking all of those things, but it would be a Valley Health Regional Collaborative one, because we really want like our smaller towns to be able to have access, because in Greenfield, I can post on the city webpage. Because Jonathan can just, like we did with the West Nile, he just popped it up for us. But for the smaller towns, they don't have anything or IT people to help or communications directors. So what we're hoping is that we get one for VHRC. We can put it on Facebook, Instagram, Twitter, whatever we could possibly do just to like get our stuff out there.
Right. Cool.
Question. I think last month we discussed there was kind of a groundwater contamination.
Oh, yeah.
Was there any update on that?
On the what?
Lund property.
On the
Oh, the
field.
Lund, it's for Lund. So I believe they want to meet in September. We talked about possibly trying to do August. They couldn't make August. So I'm hoping September. I'm still waiting on the phase 2 plan from the people that are renting Lund. We've kind of been going back and forth with DEP on that, so I'm hoping to work more into getting that. But I think it will be good because I think the deal is hopefully we can meet, they'll do a little presentation on the history of Lund. And then I think once you get a better understanding of what's going on there, I think it will be a good idea to talk about what we can do to protect the people in the buildings. As far as we can do with maybe air quality monitoring or possibly well monitoring, since we do own the buildings and it is our right to, make sure that the people that are going in there are protected. So I think after they do a presentation, get a better understanding of what's happening there, then we can get into a broader discussion on what we can do as a board to kind of protect the people that are going in there. So I'm hoping by September. I believe they agreed September. So I'll try to set that up for September.
Sounds good.
All right. Do we have any? Business?
We didn't have any old business. Last meeting was just the Q&A, so.
Oh, one thing, sorry, the vaccine clinics, I think we talked about that a little bit in one of the meetings. The state is not, we got a final decision. They're not going to be paying for vaccines this year.
Right.
Just not going to happen. But I did partner with Stop and Shop. The mayor signed off on it. So we will be able to provide vaccines in clinics. They take insurance. If there's like 1 or 2 people that don't have insurance, which is kind of how our vaccine clinics have always gone, is there's a couple of people that don't have insurance that come and they will just let that go. As long as the majority of the people coming have insurance. So we partnered with Stop and Shop and we have a clinic set up in September at the senior center so far. And if that goes well, we'll set up a few more. I'm not sure the school, maybe Ellis can help. It sounds like the school doesn't have a school nurse leader anymore. And she was the one that kind of helped us get into the schools. So we'll have to figure that out as we get closer.
This is COVID and flu?
Yes, they will do COVID and flu. I think they'll actually do more than that if needed.
Oh, like all immunizations.
All adult immunizations. I don't think they
Cool.
have PD doses that they'll
Okay.
bring, but yeah, I'm pretty sure that they'll bring whatever we need if we tell
Great.
them we need it.
Awesome. Great. Yeah. All right. Anything else?
No.
All right. Move to adjourn.
Second.
All right. Vote. Unanimous. All right. Meeting adjourned.